showing my surroundings. This is where my computer's sitting. This is my equipment, blank paper, my vision chart, all this other stuff, nothing on the floor. Okay. Whoa. Oh, just kidding. Okay, first I'm going to do a brain dump, and when I'm done with my brain dump, I will say when I'm starting my video. I'm going to be testing. So, and I'm going to do compose using I will now be starting my video. Hi, my name is Danielle. I'm going to be your student nurse today. Can you get your first and last name? Anna Hyman. And your date of birth, June 17, 2004. Do you have any allergies? No. Checking your wristband, checking provided orders. Okay, it looks like today we're going to be doing a head, ears, eyes, nose, mouth, and neck assessment. Is that okay?
Yep.
And I've provided privacy and performed hand hygiene, and I'm going to cleanse my equipment. Starting with the head. Starting with the head, do you have any history of seizures?
No.
Do you have any history of headaches?
No.
Have you had any injuries to your head?
No.
Okay, I'm going to check the symmetry of your head, symmetrical, and it's symmetrical, color is normal, and position is normal. I'm going to inspecting the hair. The color is normal. Well, her hair is brown. And the scalp is normal color. Palpating the head, there's no tenderness or lumps. And palpating the hair, there's no her hair is thin with no breakage, and there's no infestations in her hair. And then, okay, I'm going to be inspecting the facial nerves. So starting with facial nerve number 5, I'm going to be looking for symmetrical expressions. Can I have you smile, frown, raise your eyebrows, puff your cheeks? All movements were symmetrical. And now testing facial nerve number 7 using a cotton wisp, I'm going to touch different parts of your face and have you tell me if there's any, if you feel it. Left cheek, closing your eyes. Right forehead, right cheek, chin, left forehead. Okay. Moving on to the eyes. Do you have any changes in your vision? Do you wear glasses or contacts? Have you had any injuries to your eyes?
No.
Okay, first what I'm going to do is inspect the outside of your eyes. So your iris is blue, your sclera is white with no abnormalities or lesions. Your eyelashes are evenly distributed, and there is no visible drainage, abnormal drainage or discharge from your lacrimal ducts, and your eyes are parallel, and your pupils are 4 millimeters, which is normal size. I'm going to have you pull your eyes down, looking at the conjunctiva. Color is pink and it is moist, looking at the top. Okay, I'm going to go to the side and look at your lens and cornea. Okay. No observable cloudiness or lesions. Now testing the cranial nerves. 3, 4, and 6. I'm going to have you follow my pen without moving your head. All right, eyes move together with no abnormal movements. And now I'm going to observe your accommodation. So I'm going to have my pen light out here and move it forward. Eyes move together. I'm going to inspect your pupil dilation, direct and constriction. Yeah. So while I shine the light in her left eye, I'm going to be looking at her right eye, seeing if her pupils move together. Okay. good, no abnormalities there. And now I'm going to do test her vision. So I'm going to have you hold this 14 inches away or arm's length and read the bottom line.
LTFPH.
Good. Patient has 20/20 vision and has already stated that they have no contacts or lenses. I am now going to palpate the external structures in the globes of her eyes, and then the maxillary and frontal sinuses, and there's no tenderness or abnormalities there. And then the lacrimal ducts, no abnormal discharge or excessive teariness. And moving on, before I move on to the ears, I'm going to test her peripheral vision, so covering one eye. Tell me if you can see my finger.
I can see it. I can see it. I can see it. I can see it.
Okay, other eye.
I can see it. I can see it. I can see it. I can see it.
Good. Okay, moving on to the nose. Do you have any congestion?
No.
Have you ever broken your nose?
No.
Do you experience seasonal allergies?
No.
I'm going to inspect the exterior of her nose, and there's no visual abnormalities. Color is normal and no visible drainage. Using my pen light, I'm going to have you tilt your head back, and I'm going to look on the inside of your nose. No pitosis, bleeding, or abnormality drainage in there. I'm going to palpate the outside of your nose. No, and there's no tenderness there. Now I'm going to test your cranial nerve number 1. I'm going to have you close your eyes and close one nostril. Tell me if you can smell this.
I can smell it. I can smell juicy fruit.
Good. And I'm going to move on to the ears. Do you have any troubles hearing?
No.
Do you have any ringing in your ear?
No.
Do you have any pain in your ear?
No.
Okay, first what I'm going to do is I'm going to inspect the outside of her ear, looking for any abnormal color, lesions, or drainage. And both ears look good. Now I'm going to palpate the outside of her ear or the pinna, holding it inward, and that is good. I'm going to palpate the tragus and the mastoid process, doing the same thing on the other side. Palpating the mastoid process and the tragus. Now I'm going to use my light here, and I'm going to look on the inside of your ear. So I am looking at her right ear, so I'm going to use my right hand. She's an adult, so I'm going to pull her pinna up, but if she was a child, I would pull her pinna down and out. The ear canal is normal. Earwax is yellow, which is normal, and the tympanic membrane is transparent, flat, and has no observable bulges. And I'm going to look at this ear, pulling her pinna up. Her ear canal looks good. The tympanic membrane is flat, transparent, and no visible bulging or abnormalities. And her earwax color is yellow, which is normal. And let's see. Okay, so now I'm going to be doing a hearing test. So I'm going to stand behind her, and I'm going to have you palpate your tragus, and I'm going to say 3 things and have you repeat them back to me.
R7G.
Good.
83W.
So, and she was able to hear all of that, so her hearing is intact. And that was cranial nerve number 8. I'm gonna have you stand and close your eyes, doing the Romberg test, making sure that her balance is good, and it is. So I can have you open your eyes and sit back down. Good. So moving on to the mouth. Do you have any pain in your mouth? Do you have any troubles chewing or swallowing? When was the last time you went to the dentist?
Within 6 months.
Okay, I'm going to inspect her mouth with my pen light. I'm going to have you open. Tongue is normal color. The palate is normal in color. Her buccal mucosa is pink and moist, which is good. She has 28 teeth. They are white and good repair. Gums are pink with no edema or visible recession. Oh, and her tonsils are small, good in color, and have no visible lesions. And okay. Now, using my tongue depressor, I'm going to be testing cranial nerves 9 and 10. So when I place the tongue depressor on your mouth, I'm going to open your tongue, and when I place it on your tongue, I'll have you say ah. I'm looking at the uvula. Good. Uvula is midline. Go throw it away. I will not be testing the gag reflex. If I was, I would place my tongue depressor in the back of her mouth and observing any gagging. I will not be palpating the tongue. If I was, having gloved hands, I would have my cotton swab holding her tongue, and I would be palpating the lateral, posterior, and anterior sides. And if I were to palpate her palate, it would be hard since she's an adult, but for a neonate, it would be soft. And she had normal coloration on the top and bottom of her mouth. I'm going to observe her lips, and they are normal in color and no visible lesions or discoloration. I'm going to palpate, feeling for any lumps or abnormalities, and there wasn't. And so that's good. Moving on to the neck. I'm going to inspect, looking for any abnormalities or lumps, and there is none. I'm going to be testing range of motion. So can you move your head back and forward, inside, inside, and I'll have you ear to ear. Good. Now I'm going to palpate the lymph nodes, starting at the preocular, postocular, occipital, and then tonsillar, submandibular, submental, and then her anterior clavicle, no, anterior cervical, anterior cervical, posterior cervical, and can I have you turn your head to the side? And then this would be deep cervical on both sides, and then her clavicular, and then for the thyroid gland, I'm going to have you tilt your head back and swallow. Okay, and swallow. Good. So while palpating her lymph nodes, she had no tenderness in any of her lymph nodes. None of them were swollen. I will document my findings. The room is clear. call lights in reach, tables within reach. I'm going to cleanse my equipment. Is there anything else I can do for you today?
No.
All right. Are you comfortable?
Yeah.
Okay. Free of falls, tables within reach, and call lights within reach. Thank you.